So, for those who are at the rear of the room, there's some space left here, 3 seats at least in the front row. Also happy to share a few of the seats we have here, but we need to start in time. So, and if you wish, I'm happy to share one of these seats as well, if one person wants. Okay, so everything set up? Okay, so it is my pleasure now to introduce Dr. Pedro Teixeira. He's a full professor of physical activity, nutrition and health at the University of Lisbon, faculty of human kinetics, and holds degrees in exercise science and nutritional sciences. He is a past president of the International Society of Behavioral Nutrition and Physical Activity and was the director for the National Physical Activity Promotion Program at the Portuguese Health Ministry. He currently leads a research group focused on determinants of behavioral health and health behavior change, including the role of psychedelic experiences in the process of behavioral change. He was the director of research for the Synthesis Institute and is the founder of Safe Journey, a project dedicated to promote psychedelic literacy in the population. He has published over 120 international peer-reviewed articles and has been an investigator in several NIH and EU-funded research projects. I'm very pleased to welcome you for your talk, Behavioral Psychedelics, an updated review of the evidence.
Thank you. Okay, thanks for being here. I'm short-sighted, so I'm going to see you here, which is a new experience, but lots of competition in other rooms, so I'm sure you are motivated to be here. This is my disclosure, and it's actually interesting because Andrea and David Orizzo are speaking on the other room right now, and they were guests in our events just a few months ago. Okay, so let's talk about behavior change and psychedelics, and I usually speak fast. Let's see how I do today. Why an updated review looks like a pleonasm? Because we were here 2 years ago with a similar talk where I covered this question, and this is what I'm going to try to update you on, but also take you one step further, which is to tell you where we are in terms of our research program, exploring to some degree this question. And this was based on the paper we published a couple of years ago where the rationale for this area is presented. And why behavioral psychedelics? This is a new term that I really like, but it came about in a publication a couple of years ago by 2 psychiatrists. And they coined this term, defining it as the study of psychedelics to foster intentional changes in habits and behaviors to improve health and resilience. Quite nice. However, I come from behavior change science, and we usually use other terms to define issues around behavior change. So we look at mechanisms or processes of change. We look at theories. We're very keen on exploring the theories that best explain behavior. And ultimately, the goal is to design theory-based, evidence-based interventions. So if I had to redefine that concept, I would say something like the study of behavioral predictors, that could be antecedents and correlates of psychedelics use in various contexts, of course, various substances. That is studying the potential moderating and mediating factors, which is a lot of the studies that we've conducted in our lab are focusing on these methods, finding the best theories to explain the relationships between those variables and behavior, and ultimately aiming to design and then to test interventions to change those behaviors. So this is sort of my framework to study this theme. Why health behaviors and why are they important? It should be obvious, but just to put it in perspective, the big 4 behaviors that you see here are the main responsible for most of the diseases that affect our health and our mortality rates these days. My guess, and I didn't see the numbers, but my guess is that the burden caused by these diseases is far greater, many times greater than that of mental health. So if we are, to the extent that we are successful in changing those behaviors, and we wonder whether psychedelics can play a role, we would be having an impact in public health in the medium and long term. So in my previous review, we concluded that psychedelic use, lifetime psychedelic use, was correlated, was associated with better physical health. And this came mostly at the time, 2 years ago, from the work of Otto Simonsen and colleagues. I encourage you he's a very prolific researcher in the field. As you can see here in some of the papers, positive outcomes, positive health outcomes were associated cross-sectionally or retrospectively and cross-sectionally with a lot of markers for physical health, such as the chronic conditions you see listed here. Mostly or exclusively using classic psychedelics in the case of these studies. Since then, Otto, again, has published another study looking at sick leave days and psychedelic use, also with classic psychedelics, again, showing improved or lower leave sick days in psychedelic users. And more recently, a study, in this case looking at MDMA use, also looked at the number of chronic disease factors, or chronic diseases actually, or predictors of chronic disease. And again, MDMA users were more likely to have lower rates of these diseases through the course of their lifespan. Cross-sectional, of course, there's a lot of limitations. Otto typically controls for a lot of variables, including using other substances. So these are interesting findings that I was curious to follow up on. But that's health. That's an outcome. What about specific behaviors? Are they also different in users versus non-users? You can look at the research coming from Hopkins. Matt Johnson just came in the room. They looked at survey studies looking at other substances and how they correlated or were associated with psychedelic use, in this case alcohol and substance misuse. But other questions were also in those surveys. And interestingly, you see that about half of the sample that had used psychedelics also reported improved diet and improved exercise as a result of their psychedelic experience. So intriguing results. And this 50% number comes up a lot in different studies, meaning people go through psychedelic experiences and about half of them spontaneously seem to see improvements in their health behaviors, in particular these two, which interest me specifically. Also, you might be familiar with the ayahuasca and public health series led by ICers. They looked at the health and health behaviors of ayahuasca users and compare that with the health of the population of the country. They found better health and better health behaviors in Spain. A new study was, or a replication study was done in the Netherlands with the same typical results. So when you compare ayahuasca samples, ayahuasca users with the general population, you see across a number of variables related to metabolic and self-perceived health, better scores in ayahuasca users, improved physical activity, for instance, or more physical activity. And we are now conducting the same study in Portugal. We just finished data collection, and I'm going to show you some preliminary results that we are presenting next week at the European Health Psychology Society. A colleague of mine, Jorge Encantado, is doing that. And this is very preliminary, so there's some adjustments to be done here. We collected over 200 data from Portuguese users. And you can see here, I just selected a few behaviors and a few outcomes, a few health outcomes. And you can see the difference in the scores, pointing to, again, better health in ayahuasca users. So mind that a lot of selection factors are involved. This is a convenience sample. And the ICers group is very keen on saying that at the very least, we can conclude that ayahuasca doesn't seem to present a public health problem. That's as far as they will go. I think, in the future, we might see more than that. But that's how it is. The only variable that was against the trend was depression. Slightly above, as you can see the rates. And you can think why that might be with all the hype around psychedelics helping with depression, that people were looking for ayahuasca at a higher rate if they were depressed. But again, all to be confirmed with further analysis and better studies. Another study from Charles Rayson, and this is the third person speaking in the other room today, which is very interesting. Again, an online survey of people reporting at least one lifetime experience, and look at the 50% number again, reporting improving in eating habits. And we are working with Chuck and his team to dig a bit deeper into the database. And for instance, we have now divided this. He just reported those data. We have a little bit more detail, but we'll follow up in the years to come. And again, Otto Simonsen, who else, just published a study last year around, again, health behaviors and physical health. And you can see it again, classic psychedelic use correlated with tobacco smoking, lower rates, with better diet. In this case, and then they did a sort of a mediation analysis or a correlation with measures of insightfulness and adaptive patterns, and they saw that those health behaviors seem to be related to the insightfulness of the experience for in this case, diet and exercise. So very interesting data that is being collected. And we're now working also with Otto and some colleagues in another database looking at psychedelic use in vegetarian diets. And you can see what we've found so far for, this is moving, but it's not me, with psilocybin and LSD, and some associations that we're finding in the UK sample between psychedelic use and, in this case, vegetarian diets, but also red meat with an inverse relationship, so lower red meat consumption in people that use psilocybin, not for LSD in this case. So this is behavior. This is what we have so far in terms of behaviors. What are the mechanisms? I won't go into detail into that for lack of time today, but last time, but you are directed, or I would direct you to a very nice paper looking at a number of psychological mechanisms that have been put forward to explain why how psychedelics work. And these are called transdiagnostic because they are broad range. They are likely to affect a multitude of behaviors. And I think many of these might be involved also in health behavior change. And we in particular are interested in a specific theory that we've been exploring for a number of years and looking if some of the premises of the theory, which is that humans have three basic psychological needs that correlate with behavior, with well-being, with thriving in life. And our hypothesis is whether these are also transdiagnostic mechanisms that could also be operational in when we go through psychedelics and our psychological processes are changing. And you can see more of that rationale in the paper I've mentioned before. So that's as far as I go in terms of updating the evidence. As far as I know, and I might have missed a few studies, this is where we are to answer the question, is there a possibility or is there a reason to believe that psychedelic use might influence one's health behaviors? And I'm talking specifically about non-addictive health behaviors. You probably know the research about alcohol cessation, about smoking cessation. Those are addictive behaviors, slightly different, although some of the mechanisms might be similar. And I won't be covering those. Actually, I just deleted these slides this morning for the sake of time. So since the last 2-3 years, we've developed, or we are developing and implementing a specific research program to explore these questions in Lisbon with the collaboration of other colleagues around the world. This is the team that is working closely with me, and Laura Carvalho, who's sitting right here, is working on her PhD. It's one of the first PhDs in Portugal, not the first, but one of the first ones to work specifically focused on psychedelic science. And these are some of the studies we have ongoing, and I will focus on 3 of them that actually are within Laura's PhD project. So the first one you may already know, it's called the ceremony study. Imperial College has been implementing it for a number of years, and with really interesting results. I'm thinking of Hannes Kettner's paper on communitas that you might have seen, comes from this database. And what we've done, I've now co-investigated on that study as well. And what we've done is we added to that study a number of measures of behavior and behavioral predictors or possible mechanisms. And we're now collecting data on that in Portugal and hopefully in other parts of the world as well. Hannes has been really helpful in helping us implement that study. And the goal basically is to go into retreat centers or any ceremonial use of psychedelics and measure people before and then continue to measure them after. So it's a naturalistic sort of observational perspective study, if you'd like. Not experimental, but as close as we can get in naturalistic terms. We have data now for 100 participants that have started, that have entered the study. Most of these are Portuguese. Actually, all of them at the moment are Portuguese. And we're now following them up and others that we will recruit through the course of the next year. And we're hoping to start analysis at some point later this year. Another very interesting study or very exciting study for us is one where we are exploring the perceptions and the experiences of psychedelic practitioners. So what is their experience with health behavior change, not only in themselves, but in their patients, in their clients? Have they seen people talk about health behavior change? Have they seen it, people speaking about it as intentions to change behavior or afterwards as they finish? We are just about to start collecting data on this study. The questionnaire is ready, everything is ready to go. And I can tell you just a brief sense of the methodology. So if you have consumed a psychedelic substance at least 30 times, and if you guided, supported, or facilitated at least 30 experiences, and this is a bit arbitrary, but that's how we define a practitioner or a somewhat experienced practitioner, you are welcome to join the study, and we'll ask questions such as the type of frequency of health behavior change that you've seen in yourself and others. And you can see we're looking at a broad range of behaviors. all of them somehow related to health and well-being. And also we're asking these practitioners, we're hoping some of them have thoughts on the matter, what mechanisms do they think are in operation? So it's very exploratory, very data-driven, but we're putting them in contact with a bunch of constructs, psychological constructs that might mediate these changes, and asking them whether you think this is working, whether you think autonomy changes is working when people are changing health behaviors. Very original, perhaps limited in some sort, but we're hoping to get, it's mostly an hypothesis building type of study. So we are just about to start data collection, and we'll see how long that takes to have meaningful or sufficient results. And finally, another one that we've just finished the questionnaire, so it's ready to go. And we're calling it International Psychedelics and Health Behavior Change Survey. We're collaborating with different colleagues around the world. Actually, Matt Johnson and Al Garcia were really helpful in helping us go through the questionnaire and refine it. We're hoping to build a broad consortia around the world to implement yet another survey. And I know there's a lot of psychedelic surveys out there, but we're hoping we can get some people involved in terms of asking them, what is their experience? What is your experience? If you've used psychedelics, what is your experience with health behavior change? Did anything change? How long did it last? Things like that. And so the questionnaires are actually similar to the questions in this questionnaire, a little shorter questionnaire because it's a population survey. So yeah, several collaborators are working with us, and we are hoping to start data collection very soon in a few months as well. So that's our research program in a nutshell. I have 5 minutes, and that's just as much as I need to thank some of the collaborators who have been instrumental in getting us up to speed with psychedelic science. Up to 4 years ago, I was a researcher in a completely other field, but we are fortunately helped by people that have been longer in the field and that have been very helpful in different ways. And now I'd like to finish with some proposals, what I'm calling an agenda. It's a bit ambitious or perhaps pompous of me to say an agenda for behavioral psychedelics. But anyway, I'll throw some ideas out there that might inspire some thought and some collaborations. So the first, of course, is studies that, or studies like the ones I've shown you that are just examples that can be conducted right away today. So for instance, does psychedelic use prospectively predict the adoption of health behaviors? Most of the studies are retrospective, but as you know, cohort studies are the state of the art in epidemiological research. So we can get a group of people that are thinking of using psychedelics, and then we can follow them, hopefully for decades, and see what happens. As it's done, for instance, in dietary studies that I know well. In clinical trials, does improvement in mental health translate to actual behavior change? This is something that's come up a lot. Matt Johnson actually talks about this a lot. It's one thing to look at psychological changes, it's another thing, or it's perhaps one step further to see if those changes translate into behavior changes that are somehow adaptive, helpful, and in people's lives, and they're, and the people they live with. So this has not been done too much, as far as I know. In naturalistic or clinical settings, use of psychedelics, are there behavioral predictors of efficacy? So are there things that people are doing, are there behaviors that people are engaging and that we can potentially prepare them for that moderate the effects of the psychedelic experience? And we all know, for instance, that meditation practice is known to potentially improve the outcomes of psychedelic experiences. There's some sort of research pointing in that direction. But what about specific diets, your microbiome, the way you absorb certain substances depending on your diet, and also nature immersion and a number of other behaviors that if we can use them, if we can study if they somehow alter the nature of the experience and the outcomes of the experience. So these are behavioral questions in essence. And finally, of course, besides the addiction studies that are already ongoing, can we influence other relevant health behaviors, such as the one I've been talking about, or even sleep or others, in sustainable ways with psychedelic experiences? And if that is the case, why is that happening? So we can improve interventions in the future. So my final slide, final slide is another way of looking into this question. So far we've looked at psychedelic experiences and the extent to which they may influence health outcomes. What about if we turn it around? How about psychedelic experiences health behaviors influencing psychedelic experiences. And I've talked about this a little bit in that next to last study, but these are studies that are begging to be done. So whether these behaviors, which we typically see included in psychedelic retreats, in our own practices, but how much do they help in preparation? How much would they help in integration? All of these are empirical questions that have not been studied. Even though we say it works or it's useful, we actually don't know from a scientific perspective for the most part. And one step further, what about fitness? Is physical fitness, cardiovascular fitness, would that be important to navigate a physically difficult, challenging experience? We don't know, but we might establish some hypothesis. Healthy diets, not dietas, another thing, but healthy diets, will they change the way people, for instance, prepare for a psychedelic experience? And exercise and physical activity, which is an area that I've been working for a long time. We also don't know if someone who's more active, who's more fit, who's less obese, for instance, whether they may respond in a different way, better or worse, or no response to psychedelic experiences. We know a few things, a little thing about it, which is a study I came about almost by accident. That is that people that are, or actually rats that were active in this study, they were better suited to deal with the toxicity of MDMA use. So my final slide, and I have 1 minute, it's my favorite one. Just to say that this is harm reduction, and harm reduction is all about behavior change. Look at the behaviors that we are asking people to do. These are behaviors. We can help promote these behaviors if we know something more about behavior, and this actually is true, for instance, at the Boom Festival, people that are checking their drugs are changing their behavior. So it's a behavior change intervention by measuring your drugs. This is by our friends at Cosmic Care, and maybe some of you participated in this study, I don't know. Finally, my favorite one, which is looking at psychedelics from a preventive perspective, preventing future health and future well-being. So to the extent that psychedelic experience, or positive, or any psychedelic experience that you have earlier in your life, whether that will translate into benefits in your mental and physical health at the end of your life or throughout the course of your adult life. And one hypothesis is, to the extent that this is happening, so that this is being improved by psychedelic experiences in some way, we can be sure that that will be improved, because this relationship is really well established. All of these are protective factors to a lot of the conditions that are killing us today, that are causing suffering today. So it's a different way of looking at psychedelics, and I think, again, these are studies that are begging to be done. So that's it. Thank you very much.
Thank you for your very interesting presentation, Pedro. I think the full room speaks for itself. Thanks for your endurance in the rear. We have some time for questions, and I see some hands raising also from the online audience. Maybe this time we start with a question from the online audience, and then we go to the second row.
Yes, there's one question from the online audience, whether you have looked in your studies if there's an inclination in psychedelic people that use psychedelics to have already these healthier behaviors.
Not in our study, to have already. Well, we have cross-sectional data, so we don't know, to the extent that I know, well, we are measuring that, but to the extent that I know, I don't think we have studied whether people that are in psychedelic retreats, if they have previous behaviors or not. That's something we can control for, previous behavior. But as we are measuring pre and post in some of the studies, we can adjust for that. Or we can measure it, actually.
Thank you for the talk. I really enjoyed it. I have a question. So you looked at substance use such as alcohol or caffeine, I don't remember exactly, but did you look at other drug use, such as cocaine, cannabis? Reason I'm asking, because if I could imagine that people who are open to its taking psychedelics might be more open to its taking other substances.
Well, all we have at the moment are adjustments for. So all of the epi studies, all of the population studies that I've shown, like I mentioned, they have adjusted for a plethora of other substances, and it doesn't seem to make a difference. And we are also asking whether, in our experimental observational studies, we are also asking about other substance use, so we can see if it changes any of the associations. So it's what we are doing. Yeah.
Hi, thanks. You touched on my question or right at the end when you said microbiome. There's a couple of published papers now, mostly in animals, showing differences in microbiome after like psilocybin or LSD research. And I also had a retreat in Jamaica, just a microdose retreat. And one of the very interesting things that we saw in the follow-ups was people's sugar consumption. Specifically like high fructose corn syrup and artificial sweeteners. There seems to be a massive correlation in mental health effects. So I'm just wondering if you guys are planning to look specific, like you know, you listed red meat and some other things, but even within the sugar category and linking that to the microbiome.
Yeah, my PhD is in nutrition, by the way, nutritional sciences. We are not looking into that, but it fits into that agenda that I mentioned of dietary factors as perhaps predictors or moderating psychedelic experiences, or even looking at effects of psychedelic experiences on diet in general, and then seeing if there are, for instance, sugar.
Like diabetes is one of your biggest
Yeah, it could be. I mean, this is 50 years of research ready to be done. Clearly, so that's a great question. The microbiome is not my area of interest or specialty, let's say, despite my PhD.
Hi, thank you for the talk. It was really, really interesting. So I have two questions. One is, have you looked at the effects of socioeconomic status and or education level? Because as you're talking about diet, and as we know, often health correlates to privilege and what we have access to and what we don't have access to.
Right. So two answers. One is in the population studies that it is adjusted for. However, as we know, participants in all of the studies that I cited are probably of a higher standard than most of the population. So I think we need to continue to look at it, not only recruiting a broad range, but also controlling adequately for factors such as those that, and as we know, as maybe you know, those are the factors that influence health the most. So if we don't adjust for that, we're always missing the boat to some extent. Thank you for the question.
Thank you for the talk. I wanted to ask about legal challenges.
Legal challenges?
Yeah, in regards to these studies. Because, I mean, psychedelic use is still illegal, I guess, in Portugal. Right. And I guess you couldn't go to like shamans and give them questionnaires. So what are the legal challenges, and what's your experience with that?
Right. So the retreats we're collecting data in are underground retreats. And for the most part, they are underground retreats. That's all I need to say. However, participating in a study is not illegal in any way. So we just have access to the participants. We ask them if they want to participate in the study, and then they are participating in a study which is fully authorized. As you know, there are exceptions for using this or for researching substances for research purposes all over the world. Now, having said that, of course, it's always tricky sometimes. In Portugal, we have decriminalized use. Helps a little bit for people to be a bit more relaxed about psychedelic use. It's not legal, but it's decriminalized. I mean, my general perspective is that psychedelic research, typically will be permitted to go or permitted to take place regardless of the legal constraints. But of course, it's always tricky, and finding facilitators and retreat facilitators that are willing to participate in research, that might cause them a little bit of fear because it may be known. But so far we've been fortunate. We're actually collaborating now, starting a collaboration with Retreat Guru, which you may know of. They sort of mediate or help retreat centers all over the world in legal and illegal settings, or mostly illegal settings, I'm not sure. And we're hoping to get a broader range of participants through this way. But the idea is collecting data from participants that are going through whatever they're going through, and then we collect them afterwards. We don't mess with what's happening in the retreat center.
So thank you very much once again, Pedro, for your interesting talk. And I'm quite sure we all would have wished to discuss a bit more, but we have to finish in time. So thank you once again.